Good day, madam. I'm Puniswari and Sharina here. We're going to present about the complementary and alternative medicine in Alzheimer's care. So, as for introduction to the Alzheimer's disease, Alzheimer's disease is a progressive neurodegenerative disorder and the most common cause of dementia. So, it's associated with the changes in the brain, including the accumulation of amyloid beta plaques and also abnormal proteins. These changes contribute to neuronal damages and progressive to cognitive decline, which can affect the person's memory, thinking, behavior, and daily functioning. So, Alzheimer's disease is progressive, and although there are treatments that may help some patients, there is currently no cure. So, therefore, Alzheimer's care should be not only focus the disease itself. Support and complementary approaches can also address the patient's connectivity, emotional, physical, and social well-being. So this approach can provide meaningful engagement, comfort, and interaction by complementing conventional medicine care rather than replacing it. So now I will move uh, to some of the complementary approach in that can used in the asthma disease. First, we have art and coloring. So this is the first approach is the art and coloring that can consider a creative and non-pharmacological approach because it gives the patient an opportunity for creative experience and also the engagement. Simple coloring activities can also provide an enjoyable and meaningful activity that can be adapted to the individual abilities. And the next is origami and craft activities. The second approach is the origami, which is involve the concentration, following simple steps, and using hand movements. So therefore, they can provide opportunity for connectivity and also the fine motor engagement. This difficulty of the activity can also adjusted according to the patient's ability. And then the third approach is the balloon and the light physical activities. These activities encourage gentle physical movement and also the active participations. They can also create the opportunity for social interaction. Importantly, the activity should be adjusted according to the person's physical ability and comfort. Another approach involved is the music relaxation, which is music and family memories can encourage emotional experiences, also engagement, while the social activity provide opportunity for communication and connection. These approaches are consistent with the holistic model of the dementia care that consider the psychological and social needs of the person, rather than focusing only on the physical symptoms. Finally, we have the dancing, combines physical movements also, music and social interaction. It can provide an enjoyable way to the participants in the physical activity and interact with the others. So the movement can be simplified and adapted according to the patient connectivity, physical and abilities. So overall, this approach are considered complementary because this can be important alongside conventional eczema care. They aim to support different aspects of well-being, including connectivity, emotional, physical, and social needs.
Okay, next I'll talk about the benefits and the limitation of the activities that we selected, which are coloring, origami, dancing, and music. So starting with the coloring, which are also art activities like origami, it can provide cognitive stimulation because patients need focus. So choosing colories or origami can engage with the activity, and also it can support emotional well-being because it gives them something enjoyable and calming to do. So since coloring or origami or any art craft involves holding and controlling the coloring materials or the papers, it can also involve fine motor skills. So at the same time, it also gives patients an opportunity to interact with the people around them. So however, coloring or this origami may not be suitable in exactly the same way for every patient. For example, some patients may have difficulties when their vision, concentration, or hand coordination. So the activity may need to be simplified or adjusted depending on their abilities. Also, the evidence for art-based activities in dementia is still mixed. So we should consider coloring as a supportive activity rather than a treatment. And next slide. And moving to the dancing or any kind of light physical activity, it combines movement, rhythm, and attention. So patients are not only moving physically, but also they are engaging with the music and following movements. So this can encourage physical movement and social interaction and enjoyment, and may also support their physiological or psychological well-being. And however, the limitation are we have to be careful with the physical activities also, because not every patient has the same mobility or physical ability. Some may become tired or uncomfortable or have difficulty following the movement as they are seniors. So the activity should always be kept simple and adapted to to the individual. Next slide. So next is music activity or therapy, which can be particularly meaningful for people with Alzheimer or dementia, especially because it may support memory and attention while also helping with emotional well being. So, familiar music can sometimes encourage reminiscence, and group music activities can create opportunities for patients to interact with each other. And the limitation can be involve individuals' response vary, which means not every patient enjoys or responds positively to the same music. The response can be different for everyone. So a song that is enjoyable for one patient may not have the same effect on another. And also, the loud or unfamiliar music could also make some patients uncomfortable or overstimulated. And although research shows promising benefits, the evidence is still not completely consistent. Next slide.
So next, I'm going to explain on the role of the facilitators. First is the clear and simple communication. So first, the facilitator should use the clear, simple communication. The instructions should be short and also easy to understand, and the patient should be given enough time to respond. So communication can also include appropriate non-verbal methods such as a gesture demonstration. So research personal dementia care highlight communication as a fundamental part of the meeting and the individual needs and the preference of the people with dementia. Second one is the facilitator should encourage the participant without putting pressures on the patients. So the positive encouragement and also support can help patients feel more comfortable. So this focus should be on the participant and enjoyment rather than whether the patient completes the activity perfectly or not. And third activity is should be adapted according to the patient's cognitive and also the physical abilities. So the facilitator should consider the individual needs and also the preference and limitation and provide assistance when necessary. This is important because personalized dementia care involves tailoring support to the individual rather than using exactly the same approach for everyone. And then safety and the comfort also important. So the facilitator should make sure the environment is suitable and also monitor the patients for the signs of fatigue, frustrations, or discomfort. If necessary, the activity should be modified or stopped. Finally, the facilitator should communicate with the patient and empathy. Listen actively, respectfully, and also understanding the patient's feeling can help maintain their dignity. Empathy is an important component of meaningful and person-centered dementia care. So therefore, the facilitator role not simply to conduct an activity. The facilitator also need to create a safe, supportive, and also person-centered environment where the patient feel respected, comfortable, and encouraged to the participate.
Next is application to Alzheimer's daycare. So during our visit to the Alzheimer's daycare, we noticed that they conducted several simple activities like music, coloring, and dancing. So the main purpose was not only to keep the patients occupied, but also to encourage interaction, participation, and emotional engagement. So In that daycare, they played familiar and enjoyable songs and encouraged the patients to sing, clap, or simply listen. We noticed that the music would easily attract their attention because some patients were very quiet and they become excited when the music started and they started singing along or clapping to the rhythm. And for the coloring activity, they provided them simple coloring materials and a bird-like structure to encourage the participant to participate in their own pace. Some patients were able to color independently while others needed guidance or assistance. So they showed us that patients had different levels of ability. And we also conducted a simple dancing activity together with the music. So instead of using complicated movement, we demonstrated easy movement that the patient could follow. So according to the daycare, they will repeat the same dancing, the same songs they every week so that they can remember the steps and they can remember the songs. So I believe that this allowed them to participate in whichever way they were comfortable with. Next slide. So next, I will explain our experience and our adaptation. So from our experience, one of the main challenges was that patients had different attention spans, um, abilities, and level of participation. So some were very responsive while others needed more encouragement or assistance. So therefore we had to adapt our activities by using simple instructions, slower movements and repeated demonstrations. We also avoided forcing participation and allowed patients to take breaks whenever they needed. And we also provided one-to-one assistance when needed, and allowed patients to participate at their own pace, and modified activities based on their ability and interest. So overall, this experience taught us that when working with Alzheimer's patients, flexibility and patience are very important. So the success of an activity was not about completing perfectly, but it was about making the patients feel comfortable, included, and also engaged. Next slide.
So as for the reflection and recommendation, through this experience, healthcare students can learn the importance of patience, empathy, respectful communication, and also the person-centered care when interacting with the individual with the Alzheimer's disease. We recommended activities such as coloring, music, light physical activities, and dancing, as these activities can provide meaningful engagement while being adapted to the patient's ability, interest, and comfort. So the complementary approach can support the patient cognitive, emotional, physical, and social well-being and contribute to the more holistic approach to the Alzheimer's care. However, complementary and alternative medicine should be used alongside with the conventional medicine treatment rather than replacing it, as its role is to provide the additional support, care, and improve the patient's overall quality life.
So, from my reflection, my experience at the Alzheimer's daycare, where healthcare students can actually learn how to be caring for the patients that requires patience, and also healthcare students like me can also learn to be patient and understand and be flexibility, as not every patient responds to activities in the same way. So we can recommend simple and familiar activities like how they did it in the daycare, because it encourages them and encourage them to participate, and they were all having fun as well. So without putting any pressure on the patients, they still can encourage, they still can be happy in that small moment. And also Cam here approaches can complement conventional care by providing additional ways to support emotional well-being, like social interaction and daily engagement, while medical treatment in professional care continue to address the patient's clinical needs. Next. So to conclude, uh, this assignment has given us a better understanding of how complementary and alternative medicine, or can also be said CAM, can be applied in the care of patients with Alzheimer's disease. Through our visit to the Alzheimer's daycare, we'll be able to see how simple activities like music, singing, dancing, or coloring could encourage patients to participate and interact and stay engaged. And we also observe that every patient responds differently. Some were more active and responsive, while others needed more guidance, encouragement, and time. And therefore, activities need to be simple, flexible, and adapted according to each patient's individual needs and abilities. And most importantly, this experience showed us that caring for Alzheimer's patients is not only about managing their medical condition, but also their emotional, social, and psychological well-being is also important. And CAM approaches can complement conventional care by providing additional opportunities, as I mentioned before, for engagement, relaxation, and social interaction. And as future healthcare professionals, this experience taught us that the importance of patience, empathy, good communication, and person-centered care, even as a simple activity, make a meaningful difference when it's carried out with understanding and adapted to the patient. So overall, we believe that combining appropriate CAM approaches with conveniential care can provide more holistic approach to supporting the quality of life and well-being of patients with Alzheimer's disease. And that's all from you. Thank you.